investigation here was not required. And if finding, you'll explain that. Then management urgent wise, you will tell that we need to keep you in the hospital. And for that, first explain that the thoughts you told me correlate with that is thoughts I'm suspecting you might be having psychosis or schizophrenia. For that, we might need to keep you in the hospital and explain the medicine and everything. And the shared plan, although the patient have the inside you tell that, is that okay with you? Will stay in the hospital. And for that, specialist psychiatrist would assess your mood again, and will start you on some medication, and that's fine. You can still say that I want to give you some reading material to read about the condition you might be suffering from or you might be having. Okay, so this would be the way you will always start with a smile, introduce yourself. Hello, please wait for the patient response. My name is Dr. Rafa, I'm one of the junior doctor here, and I'm here to help you. So smile all the time. Double check ID you will do. So Radwan, check the ID again when the patient was comfortable, and you will do the greeting and appreciation if you need to do, and identify the consultation. So this is basically a simple first presentation consultation. Then focus presenting complaint, that would be here. You'll take the incident history. Here, applicable is incident history. What has happened, how it has happened. Presenting complaint, you will come to that. So you will take more questions. When you find out what brought you today, how can you tell me more about that? Can you tell me more how the police brought you here? So again, these acronyms you can use. Here is the family. So signposting is very important. A few standard question, you can mention that. Here you can signpost that what you are going to ask. So here is no pain and Socrates. So I'm going down further to take you to the psychiatry history scenarios. So in the psychiatry, how to take this is the psychiatry history scenario. I'm going to go down. So let me go first. So when you go to the psychiatry histories, so psychiatry history, how would you take the psychiatry history? So psychiatry history, basically, you MC Famish, how are your mood lately? M for mood. So you can ask about the mood of the patient. Can you scale for 1 to 10, 1 being the saddest and 10 to the happiest? How would you rate your mood for me? Cognitive, you can ask, do you know who I am, where you are? You just check the cognition as well in the start. What is your family history of psychiatric illness? When you go to that family history, F for family history, or even you can follow the Maftosa as well. Do you have any family history of problem with the mood? Do you have family history of psychiatric illness? How much alcohol do you drink? So alcohol is important. Is there anything you do recreationally? Mean you're talking about the drugs. Condition related to the mental health, medication allergies, and previous diagnosis. Are there any ongoing medical condition you need to take care of? Are you currently taking care of any medication? These are different questions you can ask. Do you have a history of mental illness or problem with the mood? Inside, do you feel that you need medical attention? So this is the question you can ask. Is there anything you think might be wrong with you? How has this affected your daily life? That would be psychosocial. Suicide, sorry to bother you. How to ask suicide? Sorry to bother you with these questions. We sometimes feel hopeless when the time is not on our side. Have you ever experienced anything similar? It is common for us to lose interest in activities we previously enjoyed when we are in the bad mood. Occasionally, when things don't go our way, we feel hopeless and sometimes have thoughts about harming ourselves or others. Has anything like this ever happened to you? Hallucinations. All right, this may sound stupid or this may sound something different to you if you are talking about. This is the way you can ask. But do you often see things that aren't there, or do you hear voices from in this situation? They already told you. Has anyone else pointed this out before? What is the gender of voices that you hear? If the patient says yes, can you tell me what they are telling you? Do they ask you hurt yourself or others? Have you ever acted on it? Then drug, exercise, smoking. You ask, do you exercise regularly? Do you smoke? Is yes. You ask these questions again. Again, this is the thing you will follow on this structure. So that's the way you will do. I will tell you a few questions and I want you to write. I'm going to tell you a few questions and I want you to write. So those questions would be how I will tell you 10 questions that will cover every psychiatry history. Every psychiatry history, 10 questions. I'll tell you those 10 questions would be covering all the scenarios related to the psychiatry: depression, depression, panic attack, psychosis, drug dependency. Everywhere you're going to ask these questions. So first of all, you will start with the biological symptoms of depression. So what is biological symptom? Change in appetite, feeling low from 1 month, feeling low lately, feeling low. So start with low, start with the low. Do you feel low or low energy? Remember the word low. Do you feel low or your mood is low? So the word, remember low. Do you feel low mood or your mood is low? Or how would you grade your mood? Do you feel low of energy? Okay, the word low, remember that. Do you feel low, down? These are the words you need to remember for the depression. Any change in appetite mean, are you eating and drinking well? That mean that is another biological symptom of depression. So you will ask about appetite, or are you eating okay? Or maybe change in appetite, you can ask. And other biological symptom is sleep. Is your sleep is okay? So these are the biological symptoms. Out of those, you can ask anyone. Okay, Lita, I would like to ask you from the last 1 month, do you think that you're feeling less energetic, or do you feel low? Or any change in your appetite, or your appetite decreased, or change in your weight? These are the biological symptoms of depression. First, ask the biological symptom of depression. You can ask sleep, you can ask mood, you can ask. Then first asking about that few symptoms, do you think you're feeling low energy, change in appetite, and change in weight, or decrease in sleep? 4 questions you can ask about depression, biological symptoms. So I'm writing down again. So first of all, you would start with low energy, then appetite, change in appetite, or decrease in appetite. And the next question you can ask, biological symptom wise, change in appetite. And next question you can ask about sleep, decrease in sleep. These are the few questions you would ask, biological question. Then great mood, great mood, great mood for me, mood great. Ask about that. Once you're done, don't straight away go to that, I want to know that you want to harm yourself. The last question would be asking after the mood is that when someone is going through the low mood, if the low mood, you suspect there's a low mood. Sometimes they don't feel hopeful. Sometime, okay.